my name is Cici, and I am the business team leader for this semester's Software Business Accelerator project, Medefy.
And I'm Joseph Asante, the development team leader.
So when we first heard about Medefy back in August, all we really knew was that it was this cool startup from Tulsa, Oklahoma. We had no idea how complex this project would be. But over the course of the semester, both the business team and the software development team have learned a lot. For example, we finally understand how the American healthcare system works, and it looks something like this.
Also, on the dev side, we can finally say that we're pioneers because for the first time in CCW history, we've developed both iOS and Android applications. We're very excited about that. Also, we can't go without some special thanks, first of all, to Medefy's founders, Matt Scoville and Nathan Gilchrist, for allowing us to take part in your dream of revolutionizing healthcare. Also, to our dev mentor, Philip Dow, because none of the development could have been done without your help. Thanks. And
of course, thank you to all of Team Medefy for tackling an incredibly complicated project with determination, even when it felt like boiling the ocean.
Also, to the dev team, or to everyone in general, for the late nights and the early mornings that gave new meaning to the words "get wrecked." You can ask us about that later.
And now, without further ado, here are Joseph, Jessica, Daniel, Patrick, and Stefan.
Imagine going to the grocery store and not being able to see the prices for the items you're buying and not knowing how much you're going to pay until 1 month after you check out. Now, obviously, this is not how we shop for groceries, or for clothes, or for a new car. But in healthcare, Americans waste $105 billion every year by choosing overpriced providers, for the simple reason that we do not compare costs before choosing a doctor. Medefy set out to change this situation by offering the employees of self-insured businesses a way to compare the costs that they would pay across different network providers before choosing a doctor. They currently offer this software only to self-insured businesses, but they want to expand to sell to health insurance companies. The business team this semester has assessed the viability of selling Medefy's platform to insurance companies and come up with an expansion plan and product specifications that will allow Medefy to compete effectively with more established competitors in this market and reach over 500,000 members by 2020, generating over $3 million in annual revenue. The SOBA development team has, from the ground up, built iOS and Android applications that will deliver Medefy's data in a way that maximizes utilization. Hi, I'm Joseph Daniels, a finance and MIS major from Houston, Texas.
I'm Jessica Murphree, a sophomore biology major from Omaha, Nebraska.
I'm Daniel Moses, a senior international relations major from Norman, Oklahoma.
I'm Patrick Richardson, a senior computer science major from Edmond, Oklahoma.
And I'm Stefan Johanson, a senior petroleum engineering major from Tulsa, Oklahoma.
Our team leaders are Cici Zhou and Joseph Asante. Our mentor is Phil Dow, and Medefy's founders are Nathan Gilchrist and Matt Scoville. Prices in healthcare for the same service can vary widely, much more than you might think, even for commodity-type services in the same health insurance network and same city. For example, if I'm insured by Blue Cross Blue Shield of Oklahoma and I need a CAT scan in OKC, I can go to Integris Baptist and pay $800, or I can go to Integris Southwest and pay almost 2.5 times that amount for the same service. Studies consistently show no correlation between costs and quality in healthcare, and there's therefore no reason why we shouldn't choose the lower cost provider. Even so, 1 in every 7 health plans give their members no way to compare costs before going to the doctor. For these plans, members have to call into the health plan, get transferred several times, and wait 2 to 4 days for a meaningful quote. Of the plans that do offer price transparency solutions, only 1 in 50 members actually use these tools. And this is because many don't know the tools exist, and those that do find them confusing and time-consuming to use. As a result, they choose a doctor based on a referral from their primary care physician and end up paying way too much for their health care. There's an obvious need in this market for a clear, simple solution that cuts through the complexity of healthcare and of health insurance benefits to actually change the way that policyholders interact with healthcare. Medefy is the ideal solution to this problem. By combining information on an individual's specific benefits, their current spending during the year, and the negotiated rate between the provider and the insurance company, Medefy can deliver information that is both accurate and specific to the user of the application. Policyholders then use this information to select the highest value care in their network. In addition to being easy to use, Medefy is going to incentivize members to use the applications and educate consumers who otherwise don't know they could benefit from price transparency applications. Insurance companies that license tools like Medefy that effectively engage users stand to save millions of dollars per year as their policyholders make smarter, value-based decisions about their healthcare. I'm now going to give it off to Jessica Murphree, who's going to talk to you about the target market that stands to benefit most from Medefy's offerings.
Thank you. Medefy's current business model is easily adaptable to allow them to sell to insurance companies. Currently, Medefy sells to self-insured businesses on a per-member, per-month basis because they have a high instance of high out-of-pocket costs. Now, while some plans under health insurance companies cover a majority of these costs, many of them still have a high instance of personal expenses. Regardless of these variations on price, Medefy can use its current business model to sell to these insurance companies. Insurance companies form networks of providers that they negotiate prices with for different procedures. Unfortunately, the policyholder has no idea what these prices are and is effectively shopping blind. Luckily, Medefy can create a white-labeled application for the insurance company, showing the policyholder both the price and quality information of the procedure before they go to the doctor, allowing them to make the highest quality, lowest cost decision, saving themselves and their insurance companies money. Medefy stands to create significant financial gain by entering this market, and while we're going to hear about the financials later on, let's look at the numbers that make this possible. Nationwide, a majority of policyholders are in either self-insured or governmentally funded plans. Medefy currently targets self-insured policyholders because they have a high instance of high out-of-pocket costs. Large group, small group, and individual plans from health insurance companies also have a high instance of out-of-pocket costs, meaning that because the policyholder is spending more of their own money, they're more likely to want to use a price transparency tool such as Medefy to try and save themselves a little. Of the 85 million policyholders under large group, small group, and individual plans, many already have access to some form of user-specific price transparency tool. However, nearly 12 million policyholders have no access to such a tool, and it is this niche market that Medefy will target initially. Team Medefy has identified 5 initial companies that will make ideal targets for Medefy to select first. These are the largest 5 companies that we found with high out-of-pocket costs and no form of user-specific price transparency tool. By targeting these 5 companies first, Medefy stands to access over 750,000 policyholders in a very short period of time, effectively inserting themselves into this new and profitable market. Now that we've talked a little bit about who they're going to sell to and how they're going to sell their product, I'm going to hand it over to Daniel, who's going to talk a little bit more about what they're selling.
Thanks, Jess. This is a substantial market that needs an effective price transparency solution. Medefy can be that solution, but they need to increase their utilization rates above the health insurance industry average of 2%. Team Medefy has surveyed a wide range of price transparency utilization tactics, and we've identified the 3 most effective tactics that have been shown to increase utilization of these solutions. First, we recommend that Medefy implements an innovative reward program that offers a cash incentive to policyholders for choosing low-cost, high-value choices. A cash incentive has shown to increase utilization rates of a price transparency solution by up to 90% from the baseline. Moreover, 90% of these users return to that price transparency solution again for a second, third, and fourth, and so on use. This is contingent on health insurance companies being willing to distribute a portion of their cost savings back to policyholders. But Medefy can make a good case that this is a good tactic. For every $1 that has been distributed back to a policyholder, the health insurance company has seen an increase in savings by up to $8 by the increased utilization rate. Second, Medefy needs to implement a monthly email reminder program. Emails are still one of the most proven and tried forms of communication in the business world today, despite the high-tech society that we live in. Providing monthly emails as opposed to annual emails increased utilization of price transparency solutions by up to 30%. These emails should also include educational resources that can help members take control of their healthcare by learning more about how health insurance and price transparency works. Third, we recommend that Medefy implements a mobile application to complement their current web application. 62% of Americans already use mobile phones to access health information online. 20% of Americans use smartphones as their only internet access point on a regular basis. Implementing a mobile application will allow Medefy to increase their user base and vastly increase their utilization rates. Unfortunately for most companies, a mobile application is a laborious process that takes a lot of time, money, and expertise. But fortunately for Medefy, our development team has developed not one, but 2 mobile applications that will increase their usership and increase utilization rates. I'm gonna hand it over to Patrick now from the development team to show you exactly what went into creating these products and show you a little bit about how they work.
Thank you, Daniel. We believe that the Medefy mobile application will help drive these utilization rates by providing a dedicated access point to their policyholders. These mobile applications will bring the power of Medefy to policyholders' fingertips whenever they're needed in a convenient and easy-to-use format. Moreover, these mobile applications will be the fastest way to receive such price information. As Joseph earlier pointed out, the 5 insurance companies we are currently targeting have no form of user-specific price transparency, which means that they deliver price information to their policyholders through a system of phone calls, which are typically transferred 3 to 7 times for an average wait of 2 to 4 days, usually for just a generic price quote. The solution Medefy will offer to these insurance companies will bring personalized price information to their policyholders with only 2 taps of navigation from the time they log in. To help bring these utilization goals to life for Medefy, the SOBA development team has, for the first time in CCEW history, developed both iOS and Android applications to solve this problem. These platforms together will make Medefy compatible with 95% of active smartphones. Our development process included writing over 64,000 lines of code and conducting almost 24 user experience tests to identify and eliminate potential bugs and sources of confusion within the app. Now that I've told you a little bit about how Medefy can help insurance companies, I'd like to take a minute to show you how it can be useful to the average policyholder. Let's say, for example, that I had been experiencing headaches for the past couple days. I would likely go see my primary care physician, who would in turn recommend me to a specialist, say Dr. Zhou, for example, for a CT scan and a more precise diagnosis. Here we can use Medefy to shop for this procedure. With one tap, we can easily log ourselves into the application and are brought directly to the search page. From here, we can search for the procedure on which we wish to shop, in this case, a CT scan. With one tap, we are brought to a list of providers and facilities offering this procedure in our network and our local area, organized by price. We can see that Dr. Zhou, who had been previously recommended to me by my primary care physician, is among the most expensive providers for this procedure in our network. Luckily, Medefy makes it easy to compare and shop our options when looking for healthcare decisions. We can easily see that Dr. Asante offers this procedure for less than half the price of Dr. Zhou. With a second tap, we can view more detailed information about this procedure, including a simple breakdown of price, more information about the doctor, easy access to directions, and the ability to call and schedule an appointment. Now that I've talked to you a little bit more about how Medefy will be useful to policyholders, I'd like to turn it back over to Daniel to talk about how Medefy will stack up against existing price transparency solutions in this market.
Thank you, Patrick. We feel that with the mobile application and the rewards program, Medefy will truly differentiate itself from even the most proven price transparency solutions. Castlight, Change Healthcare, HealthSpark, and Vital Smart Shopper have been the most successful companies at increasing utilization rates, and many of their tactics resemble some of the recommendations that we have made. Providing provider quality ratings with the price is essential to users. When it comes to healthcare, people want to know that the low-cost service that they're going to get also has a high quality because it's about their health. Medefy implements this, as do the other successful companies. Education tools and reminders have also increased utilization rates significantly. Medefy will implement this going forward. The rewards programs and the mobile application are two of the most successful tactics used to increase utilization, and Medefy is the only one that does these better than the competition. Castlight does not offer cash incentives to their users for making high-quality, low-cost healthcare choices. Vital Smart Shopper does, but they are currently in the early developmental stages of their business, and we feel that with a mobile application that our team has developed, Medefy will be able to compete with and eventually beat out Vital Smart Shopper in moving into the target market of regional insurers, as these are the only two companies that currently focus on this target market. Increasing utilization through these proven tactics will increase the amount of money saved by policyholders and their health insurance companies, and will make Medefy money on the way to doing so. In order to show you exactly where these cost savings are going and how Medefy is going to make money, I'm going to hand it off to Stefan, and he's going to talk more about that.
Thank you, Daniel. So insurance companies will license Medefy because they stand to save a substantial amount of money by doing so. Since insurance companies cover a portion of their policyholders' healthcare spending, they stand to benefit whenever these policyholders make high-value choices. Now, to see just how much money that these insurance companies can save, let's take a look at an example with Community Care of Tulsa. Currently, we've determined that Community Care can save $365 for each policyholder that uses a price transparency solution. But at the average rate of only 2% utilization, Community Care only stands to save $850,000. By using engagement tactics like mobile applications, email reminders, and rewards programs, these utilization rates have been seen to jump to between 20 and 50%. By using 20% as a conservative benchmark for Medefy, they would stand to save Community Care $8.5 million per year. Now, this is at a cost to Community Care of only $850,000 based on a volume-based pricing model that ranges from 10 cents to 60 cents per member per month. Now, this represents a 13 times return on investment for this insurance company, which is very attractive considering that the average profit margin is only 4%. And there's still a large amount of potential remaining in these applications. As Americans become more accustomed to shopping for their medical procedures and Medefy strengthens its platform, we find that these engagement rates should move toward the higher range of 50%. If Medefy could see 50% utilization, they would stand to save Community Care $21 million per year. Now, Medefy also stands to benefit substantially by licensing these price transparency tools to insurance companies. Medefy should target insurance companies after they've established themselves with self-insured businesses, but they need to prepare to enter this market by going on a sales and marketing campaign through the duration of 2016. This campaign will enable them to license to their first partner midway through 2017, and as their marketing and sales team grow, we anticipate them being able to license to 13 insurance companies by 2020, growing their yearly revenues to $3 million. These financial projections represent $2 million in cumulative profit and a break-even rate that occurs midway through 2019. Now, to be able to do this, there's still some next steps for Medefy to take. They need to outline the details of their rewards program and their engagement strategies, and also start to hire a marketing and sales team to build relationships with these insurance companies. On the application side, Medefy needs to develop the data that is used to provide quality information for the providers, and also develop an analytical system that enables them to show just how much money they're saving to their customers. After that is done, they need to implement the rewards program into their mobile application. Targeting insurance companies exposes Medefy to a large market with the potential to drastically increase their average sales size. The dynamics of their product largely remain the same, and by focusing on engagement, Medefy can grow their revenues from insurance companies to $3 million per year, saving insurance companies and policyholders tens of millions of dollars. We've had a great time working with Medefy this semester in examining this potential market, and we are confident that our recommendations will help enable them to be successful moving forward. Thank you for your time, and we would now like to open up the floor to questions.